and welcome to Disorient. Help support Disorient by buying me a tea or becoming a patron as you are able. Links are in the description. Thanks for your support. What is anxiety? Before I start, I'm going to preface this with, I'm not a mental health professional, and all the information in this video is from my lived experience and reading on anxiety and other people's experiences. If you're in crisis, please be brave and seek help. Let's start with the science of anxiety. There's a part of our brain called the amygdala, and we each have two of them, one in the left side of our brain and one in the right. The amygdalas are shaped like big jelly beans and are our primitive lizard brains that alert us to danger. They send the rest of the brain alert signals that tell the body's sympathetic nervous system to make stress hormones like epinephrine, adrenaline, and cortisol. A lot of these hormones can trigger our fight or flight response, which amps us up to run away from the saber-toothed tiger that people seem to use a lot when talking about anxiety. I think that modern-day cars are far more dangerous than a saber-toothed tiger, but yeah, that's besides the point. A note that fear and anxiety are different. Fear is directed at a specific object or situation, while anxiety is more free-floating, vague, and centered around unknown things. When our anxiety is at healthy levels and working well for us, it can energize us to meet our goals and protect ourselves. For example, I'm a musician, and I do get nervous before I perform, which can be really stressful and annoying, but it's actually totally normal and helps me by upping my energy so I can perform enthusiastically. Whereas if I didn't have this pre-performance anxiety, I'd be performing while half awake, and that'd be really boring and dissatisfying to watch. Sometimes, though, our amygdala goes overboard, and the thoughts and feelings that come with this heightened anxiety make life really hard to deal with. At this point, we cross over from healthy, productive anxiety into the land of anxiety disorders, which interfere with a person's ability to function in everyday life and cause significant distress. A person's likelihood of having an anxiety disorder comes from both nature and nurture. Our genes and individual personalities affect our tendency toward anxiety, and our environment, relationships, and life experiences also shape our actions, beliefs, and feelings. There are a number of anxiety disorders listed in the DSM-5, the manual currently used in the US for diagnosing mental disorders. I think it's important to note that these diagnoses are not black and white or set in stone. Diagnoses might change over time. You might be diagnosed with an anxiety disorder and then, after a while, feel better to the point where you wouldn't be considered as having that diagnosis anymore. Or you might have one type of anxiety, and then the anxiety might change into something that's better described as a different kind of anxiety. Or you might have multiple anxiety or other psychiatric disorders at the same time. Basically, anxiety symptoms are dynamic and don't follow a nice straight path. They can change, go in and out, you name it. What an anxiety diagnosis is not is a static condition that will stay the same forever, nor is anxiety something that you permanently are. Anxiety might make it seem this way, but as someone who has known anxiety very well, I will tell you this. Anxiety can get better, and you can be okay, even if it seems like getting better is taking forever. What an accurate anxiety diagnosis can do is help you and others in your life better understand what you're going through, and then you can better figure out how to manage your anxiety. Another benefit of knowing you have anxiety is that you can meet others who have similar struggles, whether in friendships or online support groups, and all this can help you know that you are absolutely not alone in living with anxiety. The course of anxiety changes as you and the life you're living change. And yes, this can be so scary, especially if you're dealing with bucket loads of anxiety. But for me, on my wiser days, remembering the fact that anxiety can and will change over time gives me hope that what feels really awful now can change for the better, whether in a few hours, days, months. And patience is another story for me. But, anyways, whether you're able to believe that anxiety can get better or not in this moment, and it's okay if you can't, I just want to let you know that having anxiety doesn't make you a giant, shameful failure. It's not a dishonor to your family, even if your family members believe it is. And you are not a wuss, a worrywart, whatever. You're a messy, feeling, complicated human being who struggles sometimes. And that's just like the rest of us. And you deserve support and help. The first step to seeking help is recognizing anxiety symptoms in the first place. This can be really hard because anxiety is an internalizing disorder, and so much of it happens inside us. Scary thoughts and physical sensations lead us to avoid the possible scary thing in the uncertain future. Honesty is really important here, whether with yourself or with others, because oftentimes only the individual can truly know if they're experiencing anxiety symptoms. The individual must either express to others, through words or behaviors, that they're experiencing symptoms of anxiety, or recognize these symptoms for themselves, which is hard because it's totally possible to hide, minimize, or even ignore anxiety symptoms. It also doesn't help that many Asian collectivist cultures use high context, so more indirect and subtle communication, and are really reluctant to even talk about emotions. Asian cultures often use humility to save face and reject help, like, oh, no, I'm fine, even if you're not. Before we look at symptoms of anxiety, I just want to note that there's a lot of overlap between anxiety and symptoms of other mental illnesses. Anxiety frequently overlaps with depression, and they're best buddies a lot of the time. Anxiety is worry about the future, and depression involves low mood and negative beliefs about the past. So these are anxiety symptoms that one may experience. And of course, it will vary from person to person. So if you're worried about your own or someone else's anxiety, keep an eye out for these signs. In the mind, anxiety can show up as racing thoughts and what if worry statements, like, what if I totally fail? My car's gonna crash. I'm gonna mess up. What if I never finish? These thoughts can result in a reduced ability to focus on things other than these scary thoughts. Anxiety can also show up as feelings, such as nervousness and irritability. These feelings are not always visible, so it's worth asking if a person is feeling this way inside. In the body, anxiety can manifest as physical symptoms like shallow breathing, racing heartbeat, stomach aches, headaches, and muscle tension, all of which make it really hard to relax. Physical symptoms of emotional distress, which is called somatization, is very common in Asians and Asian Americans. So just because an uncomfortable sensation feels purely physical doesn't necessarily mean that there isn't an element of emotional distress that's worth addressing. Internal symptoms of anxiety, like the ones I've just listed, can lead to behaviors that are easier to see, such as avoiding anxiety-provoking situations, appearing restless, being easily startled, having trouble sleeping, and yes, feeling fatigued, because being anxious can be really exhausting. Beyond the general symptoms of anxiety, the different types of anxiety disorders have specific features. A note that anxiety symptoms can happen in everyday, healthy anxiety. What makes these conditions disorders is that they're distressing and interfere with a person's daily life. Of the more common types of anxiety disorders, we have generalized anxiety disorder, which involves worrying about basically everything all the time for at least 6 months. We have social anxiety disorder, which is anxiety around people and social situations, and the fear of public speaking is a really common fear. Specific phobias are fears of specific things or situations, like the fear of heights, specific animals like snakes, bats, or dogs, elevators, doctors, thunder, blood, getting sick. And a lot of these fears have specific names, like arachnophobia for the fear of spiders, but I'm not going to get into that. It'd take forever. Panic disorder is having panic attacks and being really afraid of having another panic attack. A panic attack is a sudden episode of intense fear that lasts several minutes. It can involve hyperventilation, a pounding heart, trembling, faintness, hot or cold flashes, being afraid that you're going crazy or dying, just to name a few. Panic disorder may lead to agoraphobia, a fear of being in situations where escape or help isn't available. Post-traumatic stress disorder, or PTSD for short, can occur in response to a traumatic, life-threatening event or events. It can cause nightmares and flashbacks, numbed feelings, and a disconnection from your present reality, which is called dissociation, a loss of interest in what used to interest you, hypervigilance and avoidance of thoughts and feelings around the trauma, and negative beliefs about yourself. If you're somehow reminded of the trauma, and we call this being triggered, PTSD symptoms can flare up. Obsessive-compulsive disorder, or OCD, involves obsessions and/or compulsions. Obsessions are thoughts or images that are intrusive, recurring, and possibly violent. Compulsions are actions or rituals, like washing, checking, or counting, that are done to try to relieve the anxiety caused by the stressful obsessions. And body dysmorphic disorder, hoarding disorder, and body-focused repetitive behaviors like trichotillomania, which is hair pulling, and excoriation, which is skin picking, are all disorders that are also on the obsessive-compulsive spectrum. In addition to these specific anxiety disorders, one can also be diagnosed with unspecified anxiety, which means that your anxiety significantly interferes with your life, but doesn't quite meet or fit cleanly into the diagnostic criteria for one of the specific anxiety disorders I just listed. Maybe it's kind of like one and kind of like another, or it's like a mishmash. But that said, the treatment for all the types of anxiety are pretty similar. So don't be too concerned if you're diagnosed with unspecified anxiety. Now that we know what anxiety disorders are, let's figure out who has anxiety. Anxiety disorders are more prevalent in women, but people of all genders, men, women, non-binary folks, can absolutely struggle with anxiety disorders. Anxiety may seem super rare, especially if people in your life and on social media and the media don't talk about it, but anxiety disorders are actually pretty common. Nearly 1 of 3 Americans will be diagnosed with an anxiety disorder at some point in their life. So basically, if you're sitting in between two people, between the 3 of you, at least one of you has probably experienced or is experiencing an anxiety disorder. Anxiety is a part of the human experience, and it affects all genders, ages, ethnicities, and races, all walks of life. This means that, yes, Asian Americans can have anxiety disorders too. Just because we're Asian American doesn't mean that we have to stuff all our feelings inside us. Being Asian American doesn't automatically disqualify us from having anxiety disorders or mean that our anxiety is somehow less. Even if our parents and friends never talk about anxiety, even if researchers fail to consider that Asian Americans exist, even if stories with anxious and authentic Asian American characters are so rare, Asian Americans can have anxiety disorders too. Just because you haven't been diagnosed with anxiety before doesn't mean that you aren't struggling with it now. It doesn't mean that you weren't struggling with it in the past. We don't need to stoically muscle our way through or ignore anxiety just because that's how our heritage culture does it. Because there is help for anxiety, good help, and you can get that help even if you are Asian American. Yes, it's so hard to find that bravery in you to seek help, but I did it even though it was one of the hardest things I've ever done in my life, and I know you can too. So, speaking of help, here are the recommended treatments for anxiety disorders in general. All the anxiety disorders basically have these treatments in common. One is psychotherapy with a therapist that you trust, particularly cognitive therapy, so the C part of CBT, and exposure therapy to help you shift your worry thoughts, beliefs, feelings, and actions. Another is lifestyle changes, which includes relaxation and grounding practices. So, like breathing exercises, meditation, mindfulness, yoga, whatever works for you. And also exercise and healthy nutritional habits. And there's also medication. Selective serotonin reuptake inhibitors, SSRIs for short, are commonly known as antidepressants. But because anxiety and depression are such close buddies, SSRIs are often prescribed to reduce anxiety symptoms. They can take several weeks to kick in, but they're longer acting and less risky to use than the other main type of medication for anxiety, benzodiazepines, which are short-acting and potentially habit-forming. If you're considering taking medication for anxiety, it's best to work with a trusted prescriber who is experienced with treating mental illness, whether a psychiatrist, your PCP, or another qualified medical professional. And so psychotherapy, lifestyle changes, and medication are the three main ways to treat anxiety disorders, and you can use whichever ones work for you. You can use all of them together. It really depends on you and what works best for you. And if you know you're dealing with a specific anxiety disorder like OCD, phobias, PTSD, it's definitely worth looking into specific treatments that are effective for that particular disorder. So that's my general overview of what is anxiety. And to my fellow anxious Asian Americans out there, you will be okay. There is help, and I know it's so hard to get help when there's so much worry inside you, but I also know that you're strong. You deserve help, and I and so many other people out there believe in you. So take care, and thank you for watching episode 6 of Disorient, and I'll see you next time.